Hello, my name is Harper, and today I am 4 months post-op top surgery. I had double incision surgery from Dr. Taylor here in Victoria, British Columbia, and I am transgender. Also, after talking about my 4-month update experience, I'm going to be talking about my 3-month appointment that I had like 2 weeks ago. So yeah, let's get on to that. Alright, this is my chest 4 months post-op. This is what it looks like. It's not just the lighting. This scar is pretty significantly better than this one. This one is quite, is a lot more stretched than the right one, and I believe it is a bit redder than this one as well. I do think that this scar has stretched a little bit since 3 months, while this one has stayed pretty much the same. I think this is also just exacerbated by the lighting in terms of like, this one is in shadow and this one is lighter. In terms of sensation, a little bit better. At 3 months I was kind of, still in the process of getting back feeling, especially around the incisions, around the nipples. And here in particular, I couldn't feel very well, but now I can feel it a lot. And it's even a little bit painful sometimes to, push and then pull. Especially, like, for example, when my partner puts his head on my chest, it's a little bit painful. Just in certain ways that the skin drags. But in general, I have a lot more feeling. I can feel, like, my incisions really, really well. I still can't feel the top layer of skin on my nipples very well, though the sensation in below is really, really good, and I can pretty much always tell when they're being touched. All in all, I'm really, really loving the results, except for the hypertrophic scarring, and my quality of life is just improving every day. It's just skyrocketed, and it's really, really great. I still haven't done any kind of exercises specifically for my chest yet, so I haven't gone to the gym, because I don't currently have a gym membership, and I've done pretty minimal home workouts, just as a general keeping fit, but nothing specific to build up my chest, though I do plan on doing that. I think that the way that the scars are placed will be really, really good for when I build my chest. And though, the scars will never truly be hidden because of muscle, they'll go along with the muscle, so they'll be less obvious. My scar care routine has changed since 3 months post-op, particularly after my 3-month appointment on July 3rd. And on recommendation from Taylor's nurse, I have been massaging my scars a lot more. I massage them at least like 3 to 5 times a day for long periods of time. And then I will do each one, and then I will moisturize them with emu oil. And then once the oil dries, I will go at it again. I do also work a full-time job, so obviously I can't be massaging my scars while I'm at work. So while I'm at work and while I'm sleeping, I will put on the scar strips, which are just silicone scar sheets from ScarGuard. They have been the best thing for my hypertrophic scars, especially in terms of making them less raised and moisturizing them. So yeah, this is my chest 4 months post-op. Oh yeah, the shininess is also from being hypertrophic. Alright, 3-month appointment time. So today is July 11th, and I had my 3-month appointment on July 3rd, so 3 months, closer to 4 months, but, scheduling. So I was supposed to see Dr. Taylor, but he was called into the OR last minute, so I saw Dr. Evans, which is his, office partner. He's also a plastic surgeon, but he doesn't do top surgery. So right when he walked in, I mentioned that I thought that I had hypertrophic scars, and he confirmed that I did indeed have hypertrophic scars, which basically means that they're raised, hard, stretched, red, and can be itchy and painful. It's apparently really common in Black people and Asian people, so me. We talked a bit about the options that I have for lessening the aesthetic of the scar and also lessening any itchiness or pain, and that was through steroid injections. And so the pros of that is that it would lessen the red color, it would bring down how raised they were, and it would lessen the itchiness and pain that I feel in my scars. The cons would be that the scars would be weaker. I'm not totally sure what that means yet, and also that there's a chance of depigmentation of my skin, like the surrounding skin, if the cortisone injection like bled below the scar, and it would be apparently quite noticeable. I told them about my scar routine, so you know how I was wearing the scar strips most of the time, and then I would also massage my scars and then moisturize them. I also asked if there's like a time limit on when to get injections, and he said that it's recommended to take them like from 6 weeks to 6 months when the scar is most active, and then afterward it would be less effective. So like even if you did it a year or two, it would have some effect, but definitely be less effective. Yeah. Dr. Evans left, and then I was left with Taylor's nurse, Mary. She took some pictures of my chest, like she had done at all my other appointments, and then she talked to me about scar care. She said that leading up until my next appointment, which I have scheduled with Dr. Taylor, I should quote-unquote go at it with the massaging, and so massage the scars frequently and fairly roughly to try and break down the hard tissue in there, and to try and just like make it better, and then to wear these scar strips at night. I then scheduled an appointment with Dr. Taylor for August 21st, and so at that point he'll look at my chest, and then we'll also discuss our options in terms of like cortisone injections and whether we want to go through with that. I'm definitely on the fence about this. Cortisone injections is not something that I necessarily, want in an ideal situation, and would definitely be a last resort for me. The scars are not exceptionally itchy or painful. They're a little bit, but not too much. So that's a good thing and a reason not to take them. But I also would really, really, really like to reduce the redness of the scars and just the overall visibility of the scars, since personally my goal would be as cis looking as possible. I've been reaching out on like the FTM BC Facebook group and on Reddit, just asking for experiences with cortisone injections for scars, particularly people of color, for top surgery scars, because I am quite interested in what depigmentation would look like on someone as dark or darker than me. Also, I know that for some people it's not as big of a deal because they want to get like a chest piece, like a chest tattoo, over their scars anyway, but personally I would not want to get a tattoo on my chest. So hiding really stretched, really red scars would be pretty difficult. I have read though that the hypertrophic nature of hypertrophic scars, like the redness and the raisedness and stuff, does go away after like 6 months to 3 years, so it's not like a life sentence or something, but just in the meantime, I would really like to, prevent and get rid of as much of the effects of that as possible. Also, it's just a waiting game. Like, I have to be patient and let my scars heal, settle down, and, just fade. Alright, well this brings us to the end of the video. I hope it was informative or helpful in some way. As always, you can contact me in a myriad of ways. All my social media is linked down in the description and stuff. Enter in calls to action here, and I'm gonna sign out. See ya.